Medically indigent, a term used in the healthcare industry describing people who can't afford health insurance. 10% of the people in the U.S. don't have access to health care. In Iowa, some counties are struggling more than others to offer enough care for their citizens. Bramer and Johnson counties are well off. Only 7% of Bramer County citizens don't have access to health care, and Johnson County has one physician for every 550 residents. Benton County isn't as lucky. They only have one physician for every 6,420 residents. Professionals in the industry each have their own ideas on what medically indigent means, so they haven't pinpointed a single definition. A former nurse and now proud supporter of rural Iowa doctors, Teresa Kingdon, said a lot of factors make someone medically indigent.
Money is one. Do you want to put a number on that? Is it less than $7,500 a year? Is it less than $20,000 a year? I think it depends on where you live and what does it cost you to live? How much does your rent? Do you have assistance? So I think that's difficult. Financial, definitely. There's a knowledge indigence, and that's the biggest problem that I see in the healthcare field right now. And healthcare is moving so fast.
Doctors in rural areas are starting to see more advanced medical issues in their patients. Those patients put off their care for multiple reasons, like not being able to afford health care or not having a way to get to the hospital. Getting the help they need is sometimes set aside so they can care for the rest of their family.
Jennifer?
A lot of people just don't come in until a disease is advanced. So part of it is access that's financial, but it's also attitude and what the patient is used to doing. And if the doctor's office is a safe place for them, then you see more appropriate behavior and you catch things early.
Over time, medicine has changed in rural areas, especially in Iowa. Dr. Swinton's journey started in 1983, when doctors simply wrote a quick note to document a patient's condition. Now, Dr. Swinton says everything is documented on a computer and strictly organized for billing purposes. He sees himself as a high-paid debt entry clerk instead of an actual doctor. The increase in paperwork has decreased the amount of patients Dr. Swinton can see on a regular basis, since a lot of his time is spent completing the necessary paperwork. The healthcare industry is rapidly changing, but sometimes rural doctors have a hard time adapting to those changes.
It's hard to keep up because things are constantly changing, and the more doctors you work with and specialists that you work with every day, you kind of sharpen each other. So when you go out in a rural area, if you trained in the 80s, you might still be practicing 1980s medicine. Having access to people that help sharpen your skills and challenge you is a real job, and you usually are so overworked that it's not much fun sitting down and reading a medical journal at night when you're in the heat of the battle.
The average age for a family doctor in Iowa is 56 years old. In rural areas in Iowa and across the nation, the search for new and younger doctors has been a challenge. In larger cities and suburbs, doctors are often paid more than in small towns, making cities more appealing.
Rural Iowa probably is struggling far more so than even the urban centers in the state in trying to attract doctors, physician assistants, the whole range of health practitioners.
Being in a rural area, it's becoming more and more complicated. The number of doctors, whether it's a family practice doc or an internal medicine, pediatrician, there just aren't enough from a primary care perspective, and the same thing goes for specialty care.
With the number of doctors and health practitioners dwindling, there are only so many clinics and hospitals Iowans can go to. Iowans have 121 hospitals to choose from across the state. Those hospitals care for Iowa's 3.1 million residents, 10% of which are uninsured. That's 310,000 people. If they don't have health care, their options get even smaller. If they do have coverage, some insurance plans only allow patients to go to certain facilities, which could end up being hours away. The result? Long waits in the emergency room and people putting off their doctor's visits until the last minute.
Where do you go? If you're having a heart attack and the closest hospital is 3 hours away, what are you going to do? Can you last that long? If you've had a heart transplant or you're on a ventricular assist device and your VAD fails and you got a 2-hour drive, you better be able to hand pump for 2 hours or you're going to die. Just there's so many different things that can be affected. And again, how long do you want to stand in line in an ER? Or in urgent care, because you will wait.
Still millions of Americans who still do not have health insurance, and health insurance is about access. Unfortunately, when people don't have health insurance, they end up going to the emergency room. When you go to the emergency room, it's the most expensive way to get your health care, and that means that all of us end up paying for it, and hospitals incur debt, and then it's just a constant round robin on how the costs are escalating.
Dr. Swinton's office in Marshalltown is about 200 yards away from the emergency room, so his patients are lucky. They can be rushed to the ER in a blink of an eye if they need to. Sometimes, if his clinic can't provide certain procedures, Dr. Swinton will send his patients somewhere else, like Iowa City. And those patients, like Tony Bruns, are grateful.
I was diagnosed with polymyositis back in 2008. The doc had to send me to Iowa City and everything, and so I mean he's been taking care of me for quite a while. I didn't have health care at the time, but when at Iowa City, man, they got to see you. So, and that's when I got on Medicare.
Since Bruns is on Medicare, he no longer has to worry about paying his medical bills. With the burden gone, he now goes to the doctor more than he did in the past. Without Medicare and the help from Iowa, Bruns may not be alive today. Despite having to travel long distance, patients are getting the care they need, which Dr. Swinton considers his #1 priority. Some of Swinton's patients have traveled hundreds of miles just to see him.
A guy that's been a heroin addict since he was a boy, about 10 years ago, and he works construction now. And he lives about 70 miles away. And he comes here every week, now every 2 weeks, for Suboxone, narcotic withdrawal prevention medicine. And he's now been off heroin for 4 weeks and just got a promotion at his job, and his boss wants him to get a subcontractor's license, and he's going to would get a couple more dollars an hour doing that, and he is just glowing. We have one patient comes from Iowa Falls that had a spontaneous lung collapse 10 years ago, and she had no health insurance, and I picked her up as just a on the call list patient when I was rounding at the hospital, and she's just continued to come here because she has a relationship, and she trusts us, and she's still an earthy character, but she's had consistent care for her emphysema and stuff for that 10 years, has had no more spontaneous lung collapses. Her Jeep breaks down a lot more often now than her lungs.
Dr. Swinton said his relationships with his patients mean more than the money. He's had the chance to change lives for the better, despite the long distances and insurance issues. Regardless of a person's financial situation, doctors should still be concerned with their health.
Hopefully we are going to get to a point in our country where we will all agree that healthcare is a basic right of our humanity, and it should not be a privilege. And up until more recent years, healthcare in America has really been more of a privilege.
With the current shortage of healthcare services across the country, more and more people aren't considering health insurance a priority. So unless your job offers a healthcare package or you can afford your own, Americans are starting to choose to live without healthcare. But some doctors have another concern outside of healthcare coverage: education.
And I think probably 90% of my office visits are spent on education of just, things to, preventative things, screenings, that kind of stuff. So I think if you can kind of, get the education in there, at least they have it in the back of their mind.
We wish the story could have a happy ending, but this story is never ending. Healthcare is constantly changing in Iowa and across the country. So what can we do? The best thing is to educate yourself on healthcare at the national and state levels, which can be done using online resources. For more on current healthcare information in the United States, visit www.hhs.gov. To find a doctor in your area, visit www.healthgrades.com. Much of the country may be far from health, but if we, as patients, take the time to educate ourselves, we may all get a little closer.